Healthcare workers in the end-of-life sector could be facing compassion fatigue, a term that describes the physical, emotional and psychological impact of helping others. And this could be preventing them from delivering holistic care.
Well, St. Luke's Hospital covered the issue during a symposium today. Grief therapist Liz Groot-Alberts was among 40 international experts who attended. And she joins us now with the CEO of St. Luke's Hospital, Tan Boon Yao. Welcome to both of you. Prof. Tan, let me begin with you. Set the context for us. How much compassion fatigue are you actually seeing at your hospital, and what's causing it?
Well, I think it's a bit hard to quantitate the numbers because I don't think we'd systematically go around screening for it. But certainly we have been putting in many measures to ensure that our staff is not reaching that stage. I think it's really a spectrum moving from compassion fatigue to burnout. And so we've been caring for them, and we don't see many, and we hope that we can, in the compassionate care for our staff, that prevents them from feeling and experiencing this fatigue itself.
Now, Prof. Tan, you've mentioned that it's a spectrum like compassion fatigue and burnout, similar symptoms, I suppose. But how does the hospital actually determine the prevalence of these conditions among your staff so that you can actually intervene early?
So we have actually created communities of care so that there are groups of people, of staff that comes together often. I think it's kind of being aware and picking up red flags among our fellow staff. To see that if they're really tired and they've been starting to lose the joy at work, that we actually spend time finding out from them some of the struggles that they have and putting in interventions to help them address this fatigue if it's setting in.
So talking about what's going on is so important. Liz, let's bring you into the conversation on this. What are some of the strategies that can actually help staff meaningfully?
Well, I think Boon Yao already talks about it. It is about together being aware of it. But personally, for every healthcare professional, it is about an awareness, checking in within oneself. Where is my joy? How much energy do I have? And it is really being aware that compassion fatigue impacts on the physical, the emotional, the intellectual, and the spiritual part of us as human beings. And that one of the things that is very important to start with is awareness and diagnosing and picking it up early. And also, like in St. Luke's Hospital is happening, that looking out for each other. And often it is our colleagues, they are the colleagues that are more aware and early aware that our tank is getting empty than actually we might be ourselves. And so some of the strategies are really about staying alert and seeing what the energy levels are, seeing how much energy and giving and caring you still want to do, or where the reluctance comes in to step in to those compassionate places where the heart really needs to come in, because the staff are givers. And sometimes it is hard to know when the giving needs to stop.
Lisa, as you've sort of mentioned that, colleagues being aware, I guess bosses being aware is rather important as well, because staff attrition, we have commonly seen is a result of not addressing all these mental health issues. But what are some of the other consequences pertaining to palliative care settings?
Well, really, the consequences are that people are leaving the job. And the other consequences are, when people still stay in the job, is that they don't have any more energy and any more drive to have those difficult conversations, to go into those difficult places, those uncomfortable places, to attend to the grieving, the big emotional feelings, because there's not enough energy inside themselves to attend to that and to take care of that.
Prof. Tan, a question to you about the manpower situation as far as nursing care is concerned. I mean, we've seen so many challenges with it during the pandemic, many staff leaving, and we recently had news that more will be hired eventually. But what is that staffing situation like in the palliative care sector, and what's being done to address it if there are issues?
Well, I think you're right in saying that nursing staff is short island-wide and not just, in palliative care settings. But obviously, with the higher demand of compassion in this sector, we do see a little more increase in numbers. But in St. Luke's itself, ironically, we have staff asking to be in this ward that we care for palliative patients, because I think it's out of the desire to look after these patients that they want to do this work. So we're not seeing that in our hospital itself, but I think in general there might be a slight higher need for this staff and a higher attrition in the palliative care sector.
And Lisa, probably just wrap things up here for us. In terms of the fundamental issues that need to be resolved, what are those in order to have a sustainable pipeline of talent?
It really needs that, just like what is happening in St. Luke Hospital, is that the staff is supported, that the staff is being listened to and being cared for, and that they are really, that it's really making sure that there are times that they have rest. And it's not only about rest to prevent compassion fatigue, it's about restoring energy. And so to provide a good workspace. It is about working together, and not only that, but also supporting staff and checking in with staff and being aware that it's not about KPIs, that it is not about the quantity of care, it's about the quality of care, and that's what staff want to provide.
Well, thanks very much to the both of you for speaking with us. And we're just talking to grief therapist Liz Groot-Alberts, as well as CEO of St. Luke's Hospital, Tan Boon Yeo.